Like a corn dog.
They say one good laugh can heal a lot of hurt.
We've had so many wonderful times together.
Randy and Tanis Toms have endured enough heartache.
Luke, I'm your father.
No.
To fill a galaxy.
It's no. I'm your father.
Raising a child with disabilities may be a challenge, but they say it's nothing compared to losing one.
I was right by his bedside.
Alex Toms was 13 months old when he died in the summer of 1988.
I remember having to leave the hospital, and I didn't want to go.
32 years later, there's still no cure for the disease that killed him. But there is a treatment.
Is there evidence that the treatment works?
Absolutely.
Absolutely, yep.
The proof, they say,
Awesome, good job.
is right in their living room.
So how was your day, bud?
Jeremy Toms has a fondness for movies, video games, YouTube, and Legos.
He's your typical teenager.
But the one thing he loves most,
You raised me up.
He loves to sing.
he'll do in front of anyone. The Toms say it's a good life,
We have a healthy child.
And a happy child.
made possible by an older brother Jeremy never met.
It is so heartbreaking.
The genetic disorder that killed their first son, Alex, is known as Krabbe, a disease that attacks nerve fibers in the brain, causing a seemingly healthy baby to progressively lose both mental and physical function. Most die before the age of 2.
It's horrifying.
Dr. Barbara Burton is a medical geneticist at Children's Hospital of Chicago.
You can imagine how devastating that is to see what looks like a normal baby, take that turn.
According to research, one adult out of every 158 is a carrier of the recessive gene that causes Krabbe. The chance that 2 carriers will have a child together, 1 in 25,000. And there's a 1 in 4 chance their baby will get both defective genes and develop Krabbe.
She was like the first girl I ever danced with.
Randy and Tanis had no idea they were carriers until it was too late.
Those were difficult times for us.
The same week Alex was diagnosed, they learned Tanis was pregnant with Adam, their second child, who's now a fully grown adult without Krabbe.
Thank God he was fine.
But 12 years after Adam was born, Tanis got pregnant a third time.
I remember hugging her and just saying, it's going to be okay.
When Jeremy was born in October of 2000,
I had so much faith.
Only 25% chance.
the Toms had his cord blood tested for Krabbe.
And the doctor came in and she said, I have bad news.
He tested positive.
And I remember screaming, no.
Yeah. I started crying so hard.
But this time there was hope, thanks to an experimental treatment at Duke University.
This was after the transplant.
Where Jeremy received a cord blood transplant.
It was very risky. We didn't want to lose him, but we had to try something to try and save his life.
He was just the 5th Krabbe infant ever to get it.
Governor Jim Doyle signed Jeremy's bill into law this afternoon.
By the age of 5, Jeremy had become Wisconsin's poster child for cord blood donations.
Overall, he's just like every other kid.
Now 19, he's one of the oldest living Krabbe patients in America, but only because his parents knew to have him tested at birth.
If you wait until symptoms appear, it's too late to transplant.
The stem cell treatment that saved his life only works if it's administered in a baby's first 30 days alive. And that's why the Toms are urging Wisconsin health officials to start testing all newborns for Krabbe before they leave the hospital.
Newborn screening has been one of the very dramatic successes of public health in the country and in the world. Dr.
Robert Steiner is an expert in metabolic diseases at Marshfield Clinic and a consultant to the state's newborn screening program.
I think we're close, but in my opinion, we're not ready to do newborn screening for Krabbe disease in Wisconsin.
14 years ago, Dr. Steiner was part of a panel that evaluated more than 80 conditions for inclusion in newborn screening programs across the country. Krabbe scored at the bottom of the list.
At that time, there really wasn't a screening test available for Krabbe. Plus, there wasn't widespread awareness of any good treatment for the condition.
Since then, a half dozen states have started testing for Krabbe, and more are developing protocols. The tests are more accurate, and more children have gotten stem cell transplants.
We have patients surviving with Krabbe disease following transplant now into their late teens.
There have been some changes. The changes have been good.
But so far, the state of Wisconsin has rejected Krabbe testing, and Dr. Steiner remains hesitant.
It's still not clear to me that this is a terribly effective treatment.
A study published in 2017 found that of 18 Krabbe transplant patients followed over a 15-year period, 5 died. The rest had significant cognitive impairments. Only 3 could walk on their own.
Those children are still, by and large, left with significant disability.
Jeremy is a high school graduate who continues to go to school by choice. He's considered a super senior. He stopped walking around the age of 7.
PB&J.
His speech is deliberate. He has seizures, and still.
He wouldn't be alive today without this.
Their lives are absolutely worth living, and their families want them and care about them.
All I can do is give you my best opinion as a scientist and a doctor.
Randy and Tanis Toms are not scientists. They are parents.
We never got to know our son, Alex.
The only evidence they need is right in front of them.
We know Jeremy. We know what he likes. We know his hobbies are, his interests, and his personality. We get to know our son and to experience life with him, and that's just so wonderful.